Hey guys, welcome back to my channel, The ENT Resident. Today we have two signs from the laryngeal disorders, and that's the omega sign and the thumb sign. And we'll talk about where do we see them, what is the reason behind each one of them, and why is it named so. And we'll talk about a few MCQ questions related to this. It can be very confusing to remember where do we see omega sign in, where do we see thumb sign in, and we'll clear up that confusion today. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign, which is the omega sign. Now, first let's look at the first image here. This is what a normal epiglottis looks like. A normal epiglottis looks like this leaf-shaped structure. Whereas in omega sign here, we will be seeing that the epiglottis looks like the omega sign that we are seeing here. You can see how it is curled up inside. So omega sign is a clinical sign that we see on performing laryngoscopy. What is this sign? Here we are seeing an inward curling of the array epiglottic folds leading to the epiglottis to appear like a omega shaped structure, and that is why this is known as omega sign. This can you tell me what is the condition in which we see omega sign? We see omega sign in a congenital laryngeal disorder which is known as laryngomalacia. So what happens here? Normally the epiglottis is a leaf-shaped structure. In omega sign, the array epiglottic folds become very shortened and they become floppy. So they end up in curling inwards during the time of inspiration. So because they get curled up, they give this omega-shaped appearance to the epiglottis over here. The primary reason that this is forming in laryngomalacia is because in laryngomalacia there is this lack of tautness in the supraglottic cartilages. So because there is supraglottic laxity, it leads to a collapse of the structure during the time of inspiration, leading to the development of this curled up epiglottis and array epiglottic folds and hence forming the omega sign over here. So laryngomalacia is the condition which we see this in. It is important to remember very commonly a lot of us end up confusing omega epiglottis with epiglottitis. That is not true. We do not see this in epiglottitis. We see omega epiglottis in a case of laryngomalacia. Now, can you tell me what is the most common cause of stridor in infants? This is in fact laryngomalacia. Laryngomalacia is the one of the most common cause of stridor that we see in infants, and this is actually a disorder in which you see most of the cases end up resolving spontaneously by about 18 to 24 months of age. Most of the time you do not need to do any treatment at all. Can you also tell me what is the kind of stridor that you see in case of laryngomalacia? The stridor that we see is an inspiratory stridor, which becomes worse when the child is supine or crying. So this is about the omega sign and a little bit about laryngomalacia in general. It's important to remember omega sign is happening because the supraglottis is floppy. The array epiglottic folds ends up curling inwards. This is not because of any kind of infection. Next is the thumb sign. Now, thumb sign is a sign of infection which we see in case of epiglottitis. So, if you look at the image here, this is an X-ray of the neck, and on the lateral view, we can see the first image that the epiglottis is actually a leaf-shaped structure, and this is what it normally looks like. But if you look at the image on the right side, this epiglottis has become very swollen up and it kind of resembles our thumb. That is why this is known as thumb sign. So thumb sign is a radiological sign that we see in an X-ray of the neck, where we see an enlarged swollen epiglottis looking like a thumb-shaped shadow. And this is what we see in a case of acute epiglottitis. So thumb sign is seen in acute epiglottitis. So what is happening here? In acute epiglottitis, there is severe inflammation and edema of the epiglottis as well as the array epiglottic folds. So the epiglottis ends up becoming very thickened and rounded. And that's why it leads to this similar shape like the thumb, and therefore it is named as thumb sign. Can you tell me what is the most common causative organism causing epiglottitis? That is the Haemophilus influenzae type B virus. And it's very important to remember in case you're suspecting that the patient has epiglottitis, you should not do a very aggressive throat examination, because the most severe complication that can end up happening here is when you're trying to attempt to see the throat, examining the throat, it can actually end up in precipitating airway obstruction. And that's why you should be very, very careful. If you're suspecting a case of epiglottitis, it is best to leave it alone and not do a thorough examination of the neck. And one last question over here. Can you tell me another sign that we see in case of epiglottitis? The other sign that we see, it is known as the tripod sign. And tripod sign refers to this particular posture that the child usually takes up when the child is suffering from acute epiglottitis. You can check out my another video on this where I talk about the tripod sign. If you have any further doubts regarding this, please note them down in our comment section and I'll get back to you. Thank you.